Hi there, it's Dr. Dodgy ringing from Brig Web Surgery. Yeah, is that Fareed Batty?
Hi there, doctor. Thank you for ringing.
How can I help you today?
Well, it's my wife who insisted I book this appointment, so
Mm.
I'm really sorry to take your time. Um, it's my back, doctor, and it's really causing problems. I've had this back pain, and I would really like to get it sorted.
Okay, so you mentioned there's back pain. I mean, is it in the lower part of your back, that middle bit just above the bum cheeks? Is that where you find it?
Yeah, roughly, yeah, it is on the right side.
Okay, and is it going down your leg at all?
No, only up to the bum cheek. Actually, no, it's not going down any further than that.
Okay, and how did it all start? What brought it on?
Well, it was about 6 to 8 weeks ago, and then, as you know, I've the Ferrari franchise just over
Mm.
the way. Um, so we're working on a skeletal staff. So occasionally I have to give the lads a hand. We have a customer who spends a lot of money with us, and this one day we were up against a deadline, so we were lifting a gearbox out of the car.
Mhm.
Um, and I was holding one side, the lad was holding the other side, and we carried out of the we were carrying out, and he lets go of his side. These things are expensive. There's
Mhm.
no way I was letting go of my £15,000. So I held on, and it was a big jar to my back. I had this tearing pain, and it's been really troublesome. And I've tried all the usual stuff.
Mhm.
It's just not working. I really need to get it sorted.
Okay, okay. So just to get a handle on it, any problems with loss of control of your bowels, your waterworks, or numbness over your bottom when you wipe yourself?
Sorry, I thought you said numbness over my bottom.
Yeah, yes, when you wipe yourself after going to the toilet.
Uh, w- is that related to the back?
Oh, yeah, it's one of the questions that we must always ask, absolutely, just to make sure we're not missing anything serious.
Okay. No, no, I haven't had any of those things.
Okay, and on a similar vein, any unexpected weight loss,
Oh no, I wish. No, I've been piling weight on.
fevers at all?
Nope, no fevers.
And, is the pain waking you from sleep?
The occasional twinge, but no, other than that, once I'm settled, I can sleep okay.
Okay. And the nature of the pain, is it stabbing, dull? How would you describe it?
It's a dull, achy sort of pain.
Okay. Okay.
Yeah,
So basically the lad drops the gearbox, dull, achy pain and ever since, getting in the way of what you want to do,
yeah.
and you need it sorting. So, oh yes, we're meant to ask about smoking.
Oh yeah, I used to be a smoker, but I gave up about a year ago after um what happened with dad. I just gave up.
Well, congratulations on stopping smoking. That really is one of the most important things you can do in terms of developing and promoting your own health.
Yeah.
And in the context of that, what about alcohol? How much are you drinking at the moment?
Oh, probably too much. I know it's no excuse, but with the problems that are going on at the minute, there's the obvious worries that I guess everybody has at the minute, and with the back thing as well. Probably, probably a couple of glasses of wine every night, maybe a few beers as well on the weekend. I know it's too much, but yeah, I'm gonna try and change that.
Certainly, I think, bearing in mind that lockdown's continuing for at least, with months, or at least a month, if not more
Yes,
to go,
yeah,
thinking about your liver, it'd be a good idea just
yeah.
to
No, I think you're right. Yeah.
and get that sorted. So, from what you're telling me, it sounds like a classic case of what we call mechanical back pain.
Okay.
This is one where basically you get inflammation in the small joints at the bottom of the spine.
Right.
And as a result of that, they get swollen, painful, and they can just irritate the nerves that flow out of the spine. And that's why you feel that pain in your bum cheek.
Right. Okay.
It's very fixable.
Right.
It just requires some really powerful anti-inflammatories like naproxen, a 500 milligram tablet, one after breakfast, one
Mm.
after tea. You normally take it for 2 to 3 weeks.
Uh,
And what you're doing is buying time for your back to heal. The
but,
plus side is it doesn't sedate you. You know, you can still keep on working.
uh,
Downside, sometimes it can cause indigestion and heartburn. And if
uh,
that's the case, I'd want you to stop it and obviously give me a ring.
right, doctor. Listen, I don't mean to be rude, but I've tried ibuprofen already, and I didn't get on with it at all. It gave me heartburn.
Well,
Um,
what I would then propose is that a slightly different twist. I think the naproxen is a good idea because it's
mhm.
the guidelines say that this is something we should try.
Right.
It often works when ibuprofen has failed. What
Okay.
we could do is give you a stomach protecting tablet alongside it called
Right.
omeprazole, a 30 milligram tablet. And if you take the two together, you should get the benefit of the naproxen with
Mm,
that indigestion side effect.
yeah.
So I'd give that 3 weeks because I think within that time frame you'd be significantly improved.
Right.
And then we could have a think, if you're cured, that's great. If you're not, then think about coming back and seeing me.
3 weeks, doctor. Can't it happen any faster?
Well, it can, the actual effects in terms of the pain relief is often within a few days. It's just
Okay.
stop it too soon,
Yeah.
the pain tends to come back.
Okay. Well, are you sure it's just the back pain that you mentioned? There's nothing more going on than that.
Yeah, it's something that we doctors see all the time.
Okay.
Mechanical back pain is the bread and butter work that we deal with. And the
Okay.
good news, it does get better.
Right. And if it doesn't?
Well, as I said, come back and see me or one of my other colleagues.
Okay. Fine. Okay, doctor. I'll see you later. Thank you
All
for
the best
calling.
there. Bye, Mr. Matty.
Bye-bye.